Going to be a focused three-paper review on COVID and microclot formation during the acute phase of disease, so this won't be considering long COVID patients. This first one is a patient study looking at plasma biomarkers and specifically thrombosis in hospitalized COVID patients, where there's 43 healthy controls that are volunteers, 63 COVID patients with 47 being ICUs, this would be severe disease state, and then 16 non-ICU patients, which would be a mild to moderate disease state. The study was performed at Columbia University Irving Medical Center in New York between April and May 2020 and then November 2020 and April 2021, where they found that blood plasma fibrinogen levels were much higher in these severe and mild to moderate COVID patients than in the healthy controls. Von Willebrand factor was also higher in the severe and mild moderate patients compared to the healthy controls. The higher levels of this fibrinogen and the von Willebrand factor show that the hypercoagulability of COVID is fibrin-mediated while also involving platelets. This next paper is a 2022 paper looking at thromboembolism in children with COVID-19, specifically focusing on children infected with asymptomatic COVID, where complications may develop during infection or several weeks after infection. The authors of this review noted that thromboembolism is a relatively common complication for COVID-19, especially in regards to children, where COVID-associated coagulopathy is characterized by elevated D-dimers and fibrinogen levels. Around 35% of children that have COVID present mild or no symptoms. Importantly, while the infection may be asymptomatic or mild in the pediatric population, some patients will still develop complications, where the authors note 3 stages of coagulopathy. The first stage is elevated D-dimers. In the second stage, there's accompanied mild thrombocytopenia. And in stage 3, there's elevated D-dimers and fibrinogen levels, which also correlates with the increase of interleukin-6 levels that confirm the link between hypercoagulability and inflammation, where adolescents over 12 years of age are particularly vulnerable, where the consequences are typically deep vein thrombosis or pulmonary embolism. They develop during infection or several weeks after infection, and also to note, these can occur in younger children than 12 and even in. Finally, we're going to look back to this COVID paper on placentitis. As a quick recap, this is a very large study that looked at about 500 hospitals across the US, where a very interesting part of the research showed that there doesn't seem to be much of a correlation between severity of maternal disease and placental infection, where some cases of COVID placentitis occurred in women that had asymptomatic infection, where this placentitis is a result of massive blood clots in the placenta. So you see all these dark red areas. These are fibrous blood clots in the placenta. What's really special about this is that the placenta is sort of acting like a storage unit for all of these microclots, which makes it like an internal history file, ultimately showing us that these are definitely occurring regardless of disease severity with COVID. All of this is just sort of to underpin that it doesn't really matter what disease state you have at all levels. If you have COVID infection, you are going to have some sort of microvascular microclotting, microthrombi inside of your blood, where this can pile up and cause all sorts of different issues.